Giving bad news to patients is one of the challenges for many doctors. They fear it, they don't know exactly the right way to do it, but it is a skill that they can learn and learn how to do better. With me is Dr. James Avery, who is the Chief Medical Officer at Golden Living in Washington, D.C. Thank you for taking the time to speak with me about this.
Pleasure being here.
Okay, appreciate it. Now, one of the things you talked about here at the AMDA Long-Term Care Medicine meeting here in Tampa is about where to start. Where should physicians start with patients when they have bad news to deliver? And one thing you said was explore and ask. Can you tell me how that strategy works?
Yeah, I think that phrase encapsulates it, is that you don't know where to go until you know where the patient is. How much do they understand about their disease? I often ask, what has their doctor told them? What has the hospital physicians told them? And once you have a feel for where they are, then you can move them to where they need to go. So that it's like any journey. You need to sort of know where you are by exploring, figuring it out, and then going from there.
Some of what you learned has been looking at patient response surveys. You're asking the patients, how did you feel when you were told that the news was given? And that's how doctors can learn how to do it better. Can you tell me some of the salient points from that?
Well, yeah, there's a study that was done in Europe of people who went to the emergency room, and when they got to the emergency room, the patients died. The family member that was there was given bad news, obviously. And then somebody went back and asked, how was the bad news given? What was the key? And what they found was the key wasn't the information. It wasn't where it was done. The key was the attitude of the person giving the news. And did their attitude meet the circumstances? And the worst possible scenario was that the physician was cold, or even worse, matter of fact. That this death, that this tragedy, whatever led that patient to the emergency room wasn't viewed as just part of a day. It was viewed by the doctor as part of the day, but as given instead of being a really dramatic thing in that person's life.
Dr. Avery, there's going to be some physicians who are naturally uncomfortable with delivering bad news. So what is your advice sort of overall for them?
Well, first of all, the fear of giving bad news is natural. They should just recognize that we don't want to get bad news and we don't want to give bad news. That's just human nature. But I think once you acknowledge that it's part of the job, then the question is, let's see, how do we do it well? I mean, let's face it, it's not natural to stick an IV into someone's skin. It's not natural to do many things that we do in medicine every day, and this is the same way. And if you go into it with skill, and that it can be learned, and that even if you're not good at it normally, you can get better at it. And I think if you know, it makes a difference. And it makes a difference in the patient, and it makes a difference in their family, and possibly their children. Then you want to do it, you want to learn about it, and you want to get better. And I'm learning every day. I don't have the answers to all of this. It's part of the journey of being a physician, and part of the journey of being truly human and completely human.
So it's an ongoing process for you as well.
Exactly.